Twongeye kubasuhuza mwese abakurikiranye SFTV. Uyu mwanya ni Tofa mugiye kuganira kuko mumenyereye tuba dufite ibiganiro byinshi bitandukanye, tuba dufite insanganyamatsiko runaka twateguye, kandi buri gihe iyo dufite umutumirwa nuko haba ari ikintu runaka ari expert wacyo agiye no kutuganiriza kuri cyo. Uyu munsi rero muri kubona ko mfite umutumirwa agiye kutuganiriza ku nsanganyamatsiko mugiye kumva mu kanya. Ndizera ko muri buze kwigiramo byinshi. Thank you so much. We give you a warm welcome here on C4 TV. I know it's not the first time, and thank you for all the contribution you're giving to our audience. So you can start by introducing yourself, since Kinyarwanda people don't know your name and they don't know who you are.
Okay, so I'm Dr. Michelle Elisburg. I'm a board-certified pediatrician. I work at family health centers at our Iroquois location, where we actually have quite a lot of our patients are refugees and immigrants from all over. So we actually have quite a lot of, probably some of your people do come see us.
All right, so yitwa Dr. Elisburg, akora kuri Iroquois Family Center, akaba ari umuganga w'abana, akaba ari byo azobereyemo. Rero akaba mu bantu yakira benshi harimo abantu babimukira bavuga ikinyarwanda n'abakongomani, ndumva abamenyere cyane. So thank you so much. Today we wanted to talk about something like maybe it's quite people know it, and some may wonder why are we still talking about it. So it's COVID-19. It's been there almost for 3 years now, and it's still a thing. So I want to ask her, why are we still talking about it? Is it still a thing? Some people may forget about it, thinking COVID has gone. So what can you tell them?
So COVID is probably never going away. It's a virus like many of the other viruses that we have, and it has changed strains, it's changed its form, but I don't think anybody thinks it's going to actually disappear.
All right. So nayo mubajije abantu benshi bibagiwe COVID, na hari n'abibaza impamvu tukiri kuyivugaho, ariko arasubije ngo COVID ntago yagiye kandi nta nubwo iteze kugenda vuba kuva mu kiremwa muntu cyangwa se mu bantu. Ni indwara igiye kuhaba igihe kirekire, kuko nk'urugero ifite uburyo yihinduranya, ugasanga uko yari imeze mbere ntabwo ari kukimeze. Tugiye kuri statistics, abantu bagera kuri miliyoni 689 nibo bamaze kwandura COVID, kandi abapfuye bagera kuri miliyoni 6. Izi ni statistic ndi kureba, kandi muri Amerika honyine hamaze gupfa abantu bagera kuri miliyoni 1, utabaze abayirwaye bagera kuri miliyoni 6. So I was talking about statistics. So what do you like statistics into Kentucky? How far are we? Like, are we still on high? Are we still getting new cases?
So we're still getting new cases. They are much less than they were. At the peak, a year or two ago, it was about 432 cases in a week. The latest data, and anyone can go to the Kentucky government website, is about 3. So it is not much right now. But as we saw, it waxes and wanes and surges. So you don't quite know when the next wave of illness will come.
Yeah, so ikintu yaravuze muri Kentucky, naho cases za COVID ziracyaza, ntago bikimeze nka kera mbere, zitangiye kugabanyuka, ariko nk'indwara yose igiriye igihe runaka izamuka n'ikindi gihe igabanyuka. Muri iyi minsi bari kugira amakesi agera kuri 3 buri cyumweru. Mbere mu mwaka ushize byari mu makesi agera muri 400 buri cyumweru. Wajya kuri website ya Kentucky ukareba. So let's go to like vaccinations. Before that, I wanted to talk about like flu and COVID, because many people confuse it. Like nowadays, people had allergies and think about maybe it's COVID. How can people differentiate that, first of all?
So allergies are very, very common, and they are also pretty seasonal. And different people have allergies to different things, unless you're like me and they're perennial. So every season there's something I'm allergic to. But allergies are usually itchy eyes, runny nose, sneezing, scratchy throat. It's worse when you get outside. You may not feel great, but you're not going to get a fever. You're not going to be really ill. You don't need to miss work or school or any of those things for allergies.
Yeah. So twari turi gutandukanya covid nko muri iyi minsi hari ama allergies cyangwa se igihe umubiri wawe uri gusubiza ku gihe turimo, nk'igihe turimo abantu benshi barwaye inkorora, barwaye imitwe se cyangwa se kwitsamura. Ibyo byinshi bijyana na allergies nko kwitsamura, kugira amaso ugashaka kwishima, no gukorora, no kugira urugero muri throat ukababara cyangwa mu muhogo, ariko ni ibintu biba bitari cyane, ntabwo ugira umuriro, nta nubwo uremba cyane. So naho bigenda bitandukana na covid mu bindi bimenyetso byo igenda igira. So about the vaccines, are we still getting vaccinated?
We are. I just want to go back for a minute. I was explaining allergies. So now I want to explain influenza or COVID and how that's different.
Yeah. That's
okay. Cool. Yeah. Sorry. So influenza is a viral illness. It's a virus that causes illness in people. COVID is a virus that causes illness in people. So whether you have the flu or COVID, you will generally have a fever, achy bones, coughing, fatigue, being really tired, loss of appetite. You will really feel sick. And how you know if it's flu or COVID, really, you can only really do a test. The symptoms are very similar, but that is an acute illness that can make you probably miss work, miss school, be really out of it.
Yeah. So yari gutandukanya influenza cyangwa se flu benshi biti bicurane no gutandukanya na covid. Ibimenyetso byinshi bijya gusa, ariko ahantu wa confirma neza kugira ngo ubimenye neza ni igihe wakoze igipimo kwa muganga, ukipima, bakagupima, bagakora test, bakareba niba ari covid cyangwa niba ari flu. Ariko ibimenyetso byinshi bijya gusa, kugira umuriro, kugira ibicurane, ukitsamura, ukabura apeti, ukababara mu ngingo zo mu mibiri. So bijya gusa, ariko iyo ukoze test nibwo ubasha kubitandukanya. So people know, so that they know the reason why they can take precautions to fight against COVID or to stay away from it. What are complications and consequences or the side effects of getting COVID-19?
So it depends. There are different strains. The virus mutates and changes its form. The ones that are out now don't cause as much disease as the original ones do, but you never know. Viruses mutate to stay in charge and be strong. So you don't really know how they're going to mutate. It's also much more contagious. And the side effects are anything, missing work and missing school is kind of bad. You're sick for probably, a week or so is, but the long-term effects, there are breathing problems, blood clots, heart problems. Some people are having long COVID, which is months later. They're still really short of breath. They can't always think very clearly. And you don't know who's going to be the one to get the long COVID. So there are some very serious including death, right? Certain people, if you're at high risk, can die from COVID.
Yeah. So nari mubajije ese COVID kugira n'abantu bamenye ko bagomba kuyirinda, ni ibihe byago cyangwa se ni izihe ngaruka igihe warwaye COVID-19 bitera ku buzima bwawe? So aravuze ngo ikintu cya mbere nuko iyo urwaye COVID, ikintu cya mbere ubwo ushobora gutinya nuko harimo urupfu, harimo death, ushobora gupfa. Nyuma yabyo ushobora kurwara cyane ukaremba, ukagira ingaruka zijya ku mutima, ukaba wagira ibibazo by'umutima bizahoraho cyangwa se bikaba byakuviramo n'urupfu. Hari ukugira ibindi bimenyetso n'ibindi bibazo bijyanye no kuba wagira, you were talking about the other like the other consequences. What did you say was heart problems, say lung disease long term, hari kugira ibibazo by'ibihaha bikamara igihe ukaba wananirwa guhumeka, hari icyo bita long covid cyangwa se covid y'igihe kirekire ushobora kugira nyuma y'ukwezi ukaba ukigira ibibazo byo guhumeka. So ibyo byose ni impamvu zishobora kugira. Go ahead.
Oh, no, I was just going to say also for pregnant women, there is a risk for preterm delivery. So there are consequences to, you know, if you're pregnant, if there's certain situations, so pregnancy, it can cause preterm birth. So there are some problems.
N'ibindi bibazo yari kuvuga bijyanye urugero no kuba umugore utwite ushobora kugira ibibazo ukaba wabyara abana ukabyira preterm birth cyangwa se ukabyara abana mbere y'igihe cyangwa se ukaba wabyara umwana udashyitse cyangwa se n'inda ikaba yavamo bishobora kuba bijyanye byose n'ibyo bibazo. So why are we getting vaccines? Like why people should get vaccines?
So that's a very good question. I think vaccines are the greatest invention of the 20th century. They have saved many, many lives. So this is about a COVID vaccine, but vaccines in general prevent disease. You don't get a vaccine after you get sick. You get vaccines to prevent illnesses that cause death. They cause significant illness. Even if you don't die, you can have long-term problems. So vaccines are ways to trick the immune system into being stronger. So if you are exposed to a certain kind of illness, your body is ready to fight stronger against it.
Nayibajije niyihe mpamvu noneho dukwiye gufata vaccine. Wenda turaza no kubiganiraho neza mu kanya, ariko vaccine impamvu abantu bazifata ni ukugira wirinde mbere yuko urwara, ntabwo ari nyuma. Ni ukugira ngo umubiri wawe ubashe kugira igihe ibashije kuza, kandi vaccine dufite ubu nicyo kintu cyaba kimaze kuba cyiza bamaze kuvumbura cyatuma abantu bakomeza kugira ubuzima bwiza. So right now I wanted to talk about vaccines in general and the reason why people are not getting vaccinated as they should. So maybe I can tell you, like I was reading, going through it, and many people have different opinions about COVID. Because these days, many are getting information from social media more than going to ask advice from qualified healthcare professionals. So these days, people are saying, hey, COVID is man-made, was lab-made disease, and we don't need vaccines because it's there, and the vaccines also are there to do, maybe to control people. I don't know if you have heard about it. They need to control us, and also it has other side effects like to reduce population. That's why they're doing it. Like people who have who did get vaccines will not give birth. Like people who did get vaccines, they will have abortions, like miscarriages, something like that. So what can you tell people about those speculations and myths?
So lots of information there. Okay, so the first thing, I think the most important thing is where you get your information from. Social media, everyone has an agenda, and they do it to inflame and get clicks and likes. So they're going to do whatever gets attention. It's not always evidence-based. You want to look at, I'm a scientist, we look at the evidence. What are the studies? What is the data? What's the information? And my agenda is to save lives and to give people education to make an informed decision. So social media can maybe bring up questions to ask, but you want to make sure that the source of your information is legitimate science. It's not fear-based, trying to throw conspiracy theories and things at you. And then really take that information and go to your medical professional. We've heard it. We don't always want to talk about all of it. But if you bring us your questions and information, we can have a conversation about what is fact, what is rumor, what is done for people to just make people afraid.
So nicyo kibazo gihari nari mubajije muri iyi minsi. Abantu benshi bafite amakuru atandukanye basoma wenda ku mbuga nkoranyambaga ahantu hatandukanye, usanga abantu bavuga ati ntabwo turi bufate vaccine kubera ko vaccine iyo uyifashe ituma abantu bapfa. Vaccine zashyiriweho kugira ngo bagabanye population cyangwa bagabanye abantu. Vaccine nizo kugira ngo badukontorore bamenye aho turi. Ayo makuru ndizera ko abantu benshi bagiye bayumva. Hari n'abakubwira ati covid ni fake, nta covid ihari kuko barayikoze muri laboratoire. Icyo ari kuvuga ni uko ayo makuru yose ntabwo uzi abantu bayashyizeho icyo bagamije. Ikindi, ese bafite ibimenyetso, bafite impamvu zifatika ziri strong. Like niba uri scientist ugomba kuba ufite factors cyangwa se ibimenyetso byerekana ko ibyo uri kuvuga ari byo. Rero niyo mpamvu ku baganga ariho ugomba gukura ayo makuru, because you once said even if it is man-made, it's killing people though.
Right. That's what I was to say. That was the next thing, right? Even if it's okay, the evidence is coming out. Who knows? Okay. That depends on your politics, what you believe. But even if it is man-made, it's real.
Yeah.
It's real. It killed, well, we just looked up, almost 7 million people around the world. 1 million of those were in the United States. So whether it's manufactured or just came out of nature, it killed a lot of people, and it's out there. It's not going away.
Yeah. So ibyo yavugaga yongeragaho ni uko kuvuga ngo wenda se vaccine cyangwa se covid ntabwo ni indwara yahimbwe, ni fake, ariko ni uko yica kandi imaze kwica abantu benshi. Twabonye ko imaze kwica abantu bajya kugira miliyoni 7 ku isi yose. Ni umubare munini cyane uruta indwara nyinshi tumaze kugira. Ikindi ni uko nutayirwanya n'ubundi nigufata ushobora kuhaburiramo ubuzima. So rero impamvu aho kuvuga ngo aho yaturutse ayo ma conspiracy theories ibyo abantu baba bavuga utazi aho bituruka, ntacyo byakumarira kuko n'ubundi ingaruka zayo iyo zikugezeho wazifacinga cyangwa wazigira. So Dr. Elisburg, so among the people that you receive, who are the age which can be affected by COVID more than others?
So anyone can be affected by COVID. In general, young children seem to do reasonably well. There are some complications. There's an inflammatory system thing where children were in the hospital for 6 or 8 weeks with long-term problems. So there are some complications. Most of the serious complications seem to be right now people who are older age, so over 65, elderly people, and people who have immune compromised systems. So people have chronic medical conditions where their immune system doesn't already work well, they're at higher risk of having more serious illness.
Yeah. Nari mubajije ese ni iyihe myaka y'abantu cyangwa ikihe cyiciro cy'abantu bari kuba bagira ibibazo byinshi bya Covid-19 bikabagiraho ingaruka. Avuze ko n'ubundi ni abantu bakuru, abantu bari mu zabukuru, imyaka 35 kuzamura, cyangwa se n'abandi bantu bagiye bagira ibibazo bitandukanye by'uburwayi buri chronic, nk'abarwaye indwara amakanseri, ibintu nk'ibyo. Hanyuma ariko urubyiruko kugeza ubu ngubu bigaragara ko abantu bakiri batoya bagira bafite ubushobozi bwo kurwanya covid, ariko bose bakwiye gukomeza kwikingiza. So to wrap these things up, I wanted to tackle down about the policy which I read. I think you are aware of it, that they added COVID-19 on a green card application as a vaccine that you have to have. We need to tackle down to tell people about it. As we were saying, why did they do it, or was it something to control people? People were saying, I want to tell people why they did it. It's a reasonable choice, reasonable policy to add that as well.
I mean, this is a very personal, people have their personal beliefs, okay? I don't believe the government is trying to control us. I have a master's in public health. I think based on the population, I look to the government to help. So in situations when COVID was brand new, lots of people were dying, the government was able to get medicines, get vaccines, get things done to serve the population. Green cards are a special situation. It's an immigration, that's a special class. The government has every right to decide what someone needs to have or do to come be a citizen of a country. At the time, the way to decrease how much disease there was is making everybody get a COVID vaccine. You know, you don't want to come into the country and bring in disease. This is no different than my aunt, you know, I'm Jewish. My family came over in the early part of the 1900s, and they flipped their eyelid and checked for glaucoma, and they checked for tuberculosis, right? You don't want to bring contagious disease into another country. I have said before, I think that eventually that rule might change as there's not as much COVID. We're not really requiring it in places of employment anymore. The public health emergency, the World Health Organization has said it's now over. We're kind of settling into we're going to see it as a regular virus like the flu.
As they add also polio.
So that may change.
We no longer have polio and the other, but we're still getting vaccinated for it.
So the reason that you're getting polio vaccine, the reason there is no polio is because everyone is vaccinated. But it has not been eradicated from the world. The only virus that is actually eradicated is smallpox. There's no smallpox. Polio still exists. So if people stop getting vaccinated, polio will come back. Polio still exists in places. Measles still exists in places. So the reason we vaccinate, if enough people are vaccinated, you can eradicate, but we don't even do it for that. We do it to decrease how much virus circulates. The less it circulates, the fewer people get sick from it. And really we just control, how much disease affects people. That's what we're trying to control. We're not controlling people. We are trying to control disease to decrease how many people get sick from it so that people can be safe and healthy in their lives.
Thank you so much. That's really good answer. It's gonna help people.
Okay.
So nari mubajije nkuko twakomezaga tubivuga, twavugaga ko abantu bagomba kwikingiza atari uko ari ikintu cyo kuvuga wenda guverinoma hari ikintu ibashaka, ahubwo ko ari uko ari ikintu cy'ingenzi cyo kurinda ubuzima bwabo. Nuko Covid-19 nayo ni imwe mu ndwara cyangwa ibyorezo byabayeho ku isi nk'izindi ndwara zabayeho nk'iseru n'izindi ndwara izo bita za measles n'igituntu. Rero izo zose ni indwara zongerewemo mu zigomba gukingirwa. Niyo mpamvu umuntu wese ugiye kubona green card agomba kujya abanza kwikingiza izi zose, akongeraho urukingo rwa Covid-19 narwo rwahindutse itegeko mu iyo ukora application. So icyo nababwira nuko ari uburyo bwo kugira ngo mugire ubuzima bwiza, ntabwo ari kugira ngo bibafashe kugira murinde indwara muzirinde n'abandi. Niyo mpamvu tugomba kwikingiza twese. Ikintu namubwira nagiye kumusaba nuko yatubwira niba inkingo zirahari. So I wanted to ask you, do you have vaccines available at where you're working at Ilkoi Family Health Centers?
Yeah, so Family Health Centers is a federally qualified health center. We have people pay based on their ability to pay, even if they have insurance or not insurance or Medicaid or public insurance. We do have vaccines. They can call Iroquois, they can get vaccinated. Our East Broadway location and our Portland location have pharmacies where they will give vaccines just through the pharmacy. So they can just go to the website for Family Health Centers, and there's places to call and find out how they can still get a COVID vaccine.
So nibyo rero mubajije niba aho akora hariya kuri Iroquois Family Center bafite amavaccine, ushobora guhamagara ukajya kwikingiza. Hari ama assurance bakorana nayo, hari n'abadafite assurance nabo hari uburyo buhari bwo kubafasha kugira babashe kubona amavaccine. Ikindi nakongera nuko n'ahandi ku mafarumasi menshi atandukanye, Walgreens, CVS, Walmart na za Kroger, henshi baracyakingira. So icyo ugomba gukora gusa ni uguhamagara cyangwa ukajya kuri website zitandukanye zabo zo kuri Family Center n'ahandi ukaba wabasha kubona vaccine yawe. So I think we should thank you so much for those information. It was really informative, and the people will gain some knowledge about it, and they will decide accordingly.
Yes,
thank you so much, Dr. Elisburg. So ni Dr. Elisburg twari turi kumwe. I don't know if you have any last message you wanted to send out to them.
No, I just think the main thing is don't make your decisions based on fear. People make up all kinds of stuff. Get good information. Go to your medical provider about medical questions, and Our goal is to help you make an informed decision to make sure that you are safe and healthy.
Yeah, thank you. Arakoze cyane message atubwiye hanyuma no kuvuga ngo ntukajye ufata icyemezo gishingiye ku bwoba cyangwa ku makuru y'ibihuha utazi, gana muganga, gana aho uvurirwa, umubaze ikibazo cyose kijyanye n'ubuvuzi agusubize. Thank you so much Dr. Elisburg. Tofa niwe mwari muri kumwe mu kiganiro This is Forward. Tuzagaruka n'ibindi biganiro bitandukanye, ndizera ko mwagiye munongerwa kandi mwagize ibintu byinshi mwungukiye muri kiganiro. Murakoze, ciao ciao, tuzasubira ubutaha.